My name is Notisha Massaquoi. I'm the Executive Director of Women's Health and Women's Hands Community Health Center. One of the things that we tend to not understand clearly, I think, in the Canadian concept is that different cultures have different concepts of being well, particularly when it comes to mental health and mental illness. So culturally adapted CBT understands the particular context of a cultural group, their understanding of mental health, their understanding of mental illness, and their understanding of mental wellness, and what are the things that would be required in order for us to ensure that this person is well. And it would go beyond sort of the confines of a traditional CBT model. In our case, it means taking that model outside of a hospital setting, bring it into a community setting, which is seen as a more holistic, safer place for people to receive services. It takes into account issues of race and racism that people are experiencing. It takes into account issues of immigrant and refugee women in our case, which is the population that we're serving. Our partnership with CAMH has been very, very successful. It's the understanding that you need to step outside of the box. So if the way that you're providing service has not been working, and as a community organization, as a group of community organizations, we approach CAMH to say, you have something that we think is very valuable, which is the culturally adapted CBT model. What we have are the clients. And they're not necessarily willing to come to you at this point in time. So it's not throw the baby out with the bathwater. It's can we partner and can you bring that model into the community? Can you support organizations such as us to develop this model further and to actually get it to the people who actually need the model, the people who it was intended to serve. And I think that's been extremely successful, that CAMH has been willing to modify how they deliver service, to bring the psychiatrist on site at Women's Health and Women's Hands, for example, to assist us with research, to further identify why this model is working, what are the issues in our communities, how can we make things more effective for service providers, to provide training for our service providers on site here in the context of Women's Health and Women's Hands, for example, and really sitting down to understand what a proper referral will look like, so that if I call my contacts at CAMH now, which this wasn't the case in the past, I'm giving my client a warm handoff. I know exactly who I'm talking to. I know exactly what's going to happen when they get there. There's not going to be any deviation. So I can honestly tell my client, when you go to CAMH, you're going to be meeting this person. This is what's going to happen. This is how you're going to be returned back to us. There's not going to be any difficulties with that process. But that's been, I think, a long development and developing a relationship in which CAMH also has to trust us as an organization. We've had to come to trust CAMH as an organization so that we can actually instill that trust in our clients.